I'm here with Rebecca Hancock, who is the Academy of Ophthalmology Specialist in Health Technology and Information, and you're currently in D.C. helping us try and work through the government changes. And I just sat through that amazing talk that you gave. It was really fantastic. But I'm wondering if you could just help me walk through this. It's complicated and challenging, and if you could help us see what are the challenges that the ophthalmologists are facing now with reimbursement.
Yeah, sure. So I talked about some of the quality reporting programs that ophthalmologists have to participate this year to avoid financial penalties in future years. So I provided an overview of the Physician Quality Reporting System program known as PQRS, the Electronic Health Records Meaningful Use program, and the value-based modifier. So these programs are very complex and complicated, and it's easy to get confused. But under PQRS, physicians are required to report on specific quality measures each year in order to avoid financial penalties. Tied to that program is the value-based modifier, and that's a program that's required under the Affordable Care Act. And using that program, CMS looks at the quality measures that a physician reported for PQRS and determines whether or not they are high quality or low quality. And they also take a look at the Medicare claims that the physician submitted throughout the year and determines if they are high cost or low cost. And then based on that, a physician could earn a financial bonus or penalty based on if they're high or low quality and high or low cost. And I also talked about the Meaningful Use program, which requires physicians to each year attest that they are meaningfully using electronic health record in order to avoid financial penalties in future years.
And you did mention that there is going to be a new quality measure referring towards diabetics and the management of diabetics. Could you just tell us a little bit more about that?
So that's in the PQRS program, and it's actually a measures group. And so it's a group of 8 quality measures, and it provides a really good option for ophthalmologists, particularly those that do not have an electronic health record, because they can report that group of measures on just 20 patients, and they get credit for meaningful use. So you do not have to jump through the normal hoop, which would be reporting 9 measures on 50% of your patients. You can do that on just 20 and you have your credit.
And which ophthalmologists do you think that would benefit the most?
I think particularly ophthalmologists without an EHR and ones that don't do cataract surgery, because for the past couple of years we have had another measures group, but it's related to cataract surgery. So any physician that didn't do surgeries weren't able to report that measures group.
And how would the IRIS reporting module help a physician who is involved in this reporting?
So it's called the IRIS Registry, and the IRIS Registry is the nation's first comprehensive eye disease clinical database. And it's a great value to physicians because it helps support their quality reporting in these various programs. So if you have an electronic health record, you can integrate it with your with IRIS Registry so that the data can automatically be extracted and populated into the registry without any extra work on the part of the physician. Then the registry can calculate your performance on the various quality measures and send that information off to CMS to give you credit for PQRS, the quality reporting portion of the Meaningful Use program, and the value-based modifier all at one time.
And the numbers you presented, are there a lot of physicians that are participating in IRIS Registry already?
So IRIS Registry launched in April of 2014, so it's been about a year and a half, and we, as of July 1, have over 8,800 physicians contracted to use IRIS Registry. And I believe we have data on over 31 million patient visits representing over 10 million patients, so it's growing at a rapid pace.
And if a physician wanted to look at their own data, could they compare it to other physicians that are participating also?
The way that IRIS works, it allows a physician to see how they're performing on certain quality metrics, and then they can compare that to other physicians within your own practice. So you can compare that to your colleague who's practicing in your same practice, and you can also compare your performance to national benchmarks.
This is a very complex issue that we're all facing, and I'm really glad that you're here today to explain it to all of us, and I really appreciate you taking the time to
Thank
be
you for
with us.
having me.